Assalamu alaikum. Can I just add to the question, if
Yeah.
possible? So a lot of the time, what I come across is we have sort of 10-minute consultations with patients, and sometimes,
The pharmacist.
I'm a pharmacist. I work in a doctor's
Yeah,
surgery.
so in the pharmacy, okay, consultation, yeah.
So I'm working in a doctor's surgery, so I prescribe medication as well. So what I find a lot of the time is the Muslim patients will come. I don't really start because we have to stick to our guidelines. So whatever first line option is, which is effective according to guidelines. So that's what they go with. And a lot of the time it is gelatin capsules. So my question is, for the non-Muslim patients, can I still prescribe? And the second question is, for the Muslim patients, they might just go along with whatever is prescribed, and do I need to start a discussion like this is the most effective medication, but by the way, this has gelatin? Because I think that would be, and same with the nasal flu vaccination for children. Maybe some mothers might be aware, maybe they won't be. It might, it's starting that discussion because we sort of expect it to whenever they want the vaccination, Muslim, non-Muslim, we should be administering it.
Okay, look, if you get a Muslim patient coming and your guidelines are that you have to give the most effective. In this case, would you know that there is a reasonably alternative halal alternative available?
Well, so there's for example, for a cough and a cold, a respiratory cough, they tend to go for a medication, which is a capsule as first line. But I know that, there's a second line option, which I personally, if I went to the doctor, I would probably go for that anyway. But it's saying to them, a lot of the time they don't bring up the discussion. They're just fine with whatever. So I think maybe it's an awareness issue. But I mean,
if the second line is equally effective and it's halal alternative, then I think it is, from an Islamic point of view, necessary to sort of bring that up or prescribe that. Or suggest that, definitely.
Because sometimes we don't really, we get instructions from the specialist saying, would give this medication, give that one. This in hospitals, they would tell us to prescribe certain medication, and we have our formularies, which is again to do with cost. So if I was to go outside of that and start doing my own thing with the Muslim patients, and then the people in the workplace would probably think what's going on here, all these liquids, expensive medications. Essentially, if I was to have that approach and start going in tomorrow, I'm not going to prescribe insulin, then because you mentioned about being a prescriber, whoever, we can't prescribe as well if it's a haram medicine. So then essentially that would mean that I can't do the job that I'm doing. But is it more that just focusing on the Muslim patients and making sure that they're aware, and because there are Muslim patients that come, and a lot of them are on insulin.
Somebody else was something.
Can I add something here? So I'm 𝗵𝗲𝗶𝗰𝗹. I'm a GP in Bolton, but currently working in Pakistan as a professor of family medicine. There is a bit more to it, as Sister already mentioned. The guidelines are not just mostly the most effective medicine. It has to do with the cost as well. And I think sometimes it's easier with the cost as well. So obviously it's if you're prescribing under NHS is different. If you're prescribing privately, it's different. But sometimes if the patient, if a patient takes an informed decision, and if the patient says, "Oh, I don't want to have it," then it's easy to prescribe, especially in acute circumstances. The patient decline this for this reason, because obviously patient can take a decision as well, and you have to respect their decision as well. So if a patient asks, let's suppose, the normal issue we get with amoxicillin, because amoxicillin is a capsule which have gelatin, and we know that. The issue with that is if you go for a liquid option, that means you have to give him 3-4 bottles again, which is not very expensive, but then it's going to be not easy for the patient then to take it. Like, adult dose will be like 4 teaspoons or 5 teaspoons and for the patient to take. But most of the time, like, if we have to give alternative capsules, which the guidelines may say no, but then if you say patient decline that, because in case of if the patient have sensitivity or patient have allergies, we always go out of the box and obviously we go for the second line instead. The only thing is I would agree, like if it's a regular medication, which is prescribed by the hospital, and if they have to definitely take it and there's no alternative available. But, it's just a bit of difficulty in that situation, but I think there is always an obvious alternative situation. The only thing is, as a GPs or as a prescriber, the pharmacist may remember it, we may not know the ingredient of each and every medicine because the type, of the amount of different drugs we have to prescribe and write down, or do as a Muslim GPs or doctors, we have to learn about each and everything.
Okay, yeah, that's just a good input there. So I think, yeah, that kind of answers your question as well, sister. Basically, the bottom line here is, conclusion is that we have to do something. We can't just leave it like, okay, it's all fine. As Muslims, as practicing Muslims, there has to be some movement, something needs to be done, like to the best of ability, to the most we can do. Okay, we are restricted by certain, if there's guidelines and legal requirements, certain things, if you're legally forced to do Islamically, then like some things which are legally reinforced, then there are exceptions for that. Like, like for example, driving on car insurance is legal requirement, we allow it. So as much as we can within the framework of guidelines, we can maneuver, then we have to do that. And some people are asking about non-Muslims as well. I mean, now, technically speaking, even to non-Muslims, not permissible, really. Technically, the general ruling of anything that we can't take and eat ourselves, like haram food, we can't give it to anybody. But there'll be a leeway here with non-Muslims because of the legal framework and the guidelines and the rules and regulations. That's number one. And number two, it's not like, coke or haram, alcohol. Like, for example, if somebody asked us, is it permissible for me to sell alcohol to a non-Muslim? That would not be allowed, or coke to a non-Muslim. But this is like, the ingredients, and then there's also a bit of secondary difference of opinion of the gelatin issue, and then, whether it's a viable halal alternative available or not, etc. And so, in that case, and it's not possible to even sort of get a non-Muslim to prescribe them as an alternative, etc. So inshallah, I think in that case would be okay. But for Muslims, I think we have to really try our best.
I think the main issue is around the cost, because we're like almost forced to prescribe certain the capsule medication as.
Yeah, sorry to cut you off. That also is one of the considerations when we said reasonably available, halal, viable, reasonably available. Now, costs is also part of the discussion of what's reasonably available or not. If it's huge costs, then we can say that it's not reasonably available. Look into that and think that, okay, this alternative is there, but it's not reasonably available because of the cost drawback. So that's also a consideration. But like the other brother said, it depends, what kind of costs. If it's like sometimes it's like huge costs, and regular costs, it's not possible because we are giving. Remember, these medicines are being taken by patients that's free, so the cost they're not paying for them, right? So the costs are of the NHS or on whoever the cost is on. So that's something that also can be considered.